Treating breast cancer is not what it once was. Back from 21st Century Oncology to tell us about the latest advancements in breast cancer treatment is Dr. Elizabeth Arguelles. Good morning. Welcome back.
Thank you.
So I learned so much from you the last time you were here. We were talking about the importance of making sure that we have monitoring or the tests done, self-exams. Let's say we get that news, unfortunately, that, or maybe some additional testing needs to be done. It says, you know, hey, we may be concerned that you have breast cancer. Talk about the latest advancements, and we've really come a long way, I think, over the last, what, even, 10, 15 years?
Absolutely. Day to day, it's changing.
Yeah.
So I think most people are worried. One of the reasons why they don't get a mammogram is because they're afraid of what it will find, or they don't do a breast self-exam because they're afraid of what they'll feel. If you feel something, if they see something, it's important that you know, because knowledge is power.
Yeah.
So a lot of times if we feel something or see something, we're going to want additional imaging, okay?
So imaging is the key thing first that normally gets done.
Correct. So usually you'll get additional mammograms, you'll get additional ultrasounds, sometimes even you can get an MRI of the breast. And radiologists, who are the doctors who look at these different imaging studies, they'll look at it and they'll see, okay, either you've had that and we're fine, we're not concerned with that, or maybe we should do some additional tests. So the additional tests are usually a biopsy.
Okay.
Before, people needed to have surgery to diagnose breast cancer. Now people don't need surgery to diagnose it. You go to your radiologist and they'll do a mammogram or an ultrasound or an MRI. At the same time, you'll be awake. They give you a little local anesthesia. They'll use a needle, take a small piece of the breast out. It's not going to deform your breast. They'll leave a little clip. Nobody should be worried. You're not setting off any airport alarms or anything, okay? It's not going to move. It's not going to spread the cancer. It marks
have you heard that before?
Correct.
I think people do
not
have
gonna spread
a misconception about that.
Not at all. It marks where it was. They can send those cells to a pathologist, who's a doctor who looks under the microscope at the cells, and that's the only way to truly know if there's cancer in those cells that they took.
Okay.
Okay.
All right. Very interesting. Now, let's say, okay, we do get that diagnosis that it is cancer. What are the treatments now? What are the most common ones that are being done?
It's changed a lot. So before, everyone used to get a mastectomy. Whole breast, completely taken off. There's lymph nodes, glands under your armpit. They would take them out.
Just to be safe.
Just to be safe. They would even take the muscle off your chest wall.
Wow.
So that's really deforming if you think about it. And it was not pleasant for the women, you know, that a breast is a big part of who we are as women, you know, as mothers. So now we found that a lot of times the breast cancer is localized just within the breast, and you can just take a little piece of the breast tissue out with an area of normal breast around it, and that's good. Okay? Sometimes you still need to take samples of the lymph nodes that are in the armpit to make sure it hasn't spread. Sometimes it has, but that's still enough with chemotherapy or radiation that can help treat the breast cancer.
As we kind of wrap up here, is it an exciting time to be in your field and kind of see where the technology has gone, where the advancements are going to, and it's just going to get better, right? We're eventually going to find a cure for cancer, right?
Absolutely. We're doing gene testing on the cancers themselves to find out who's going to respond to chemotherapy, whether they should get it. We've developed different kinds of radiation where sometimes you do the whole breast, which was traditionally done. Sometimes you can only do part of the breast. Sometimes they're shorter in treatment. It's
so
fantastic.
Bottom line, there's a lot of advancements, a lot of different options, and it's something that, again, we talked about the last time you were here. If it's caught early, is the good thing, and the survival rate is such good news right now.
Absolutely. I always tell patients, look, it is what it is. There's nothing you can do about that, but at least if you know, we're here together, and we're going to get you through this to the best we can.
And again, the success rates have been incredible, thanks to doctors like yourself. So again, welcome to Southwest Florida. We're so glad to have you here. We appreciate it. We look forward to having you back.
Thank you very much.
And of course, for more info, you can head to our website as well, fox4morningblend.com.
New cars, they come with maintenance guides, manuals. It's not really exactly hard to figure out when to change the oil. But babies, unfortunately, no, they don't come with instructions. Up next, what to expect at each baby checkup. Still to come, we heat things up with DIY candles. The bright idea on how you can make your own from home.